Hi, everyone. This is Deidre Kindred, your nurse advocate, coming to you today on Health Chats Among Friends with another amazing professional expert. So, today I am honored to have Ashley Austin Hill, and
Hello.
she is going to tell us a little bit about her consulting when it comes to residential care homes. So, Ashley, welcome. Thank you.
Thank you. I appreciate you having me on.
Well, tell us a little bit about yourself.
I am Ashley Austin Hill. I am a former surveyor with the Texas Health and Human Services here in Texas. Prior to that, I worked in the Home and Community-Based Services program, helping individuals with intellectual and developmental disabilities. I've always been in social work since I graduated college. I started out at the Girls and Boys Club, so I've been in this field for a good long time in terms of human services. But specifically about the residential care homes, once I left the state as a surveyor, I decided, you know what, I want to help. I want to assist facilities in reaching the goals that the state has for them, but also educating them in the process. And so when you're starting a facility or a residential care home in this field, there's a lot of red tape, there's a lot of regulatory information, a lot of data that has to be gone through just to understand the program. So I help my clients fill that gap and help them get through the startup phase, or if they need help with corrective action planning or provider planning or strategic planning for long-term growth. So I come in whether you are just starting a facility or you've been in business a while and you need some assistance revamping, editing policies and procedures. I kind of help them meet that compliance piece by showing them how to take the details of their facility and meet those needs in their own way.
That's so amazing. When I first met you, I had years ago, I attempted to open, no, I didn't attempt, I did, opened up my own residential care home. And you are correct. Lots and lots and lots of red tape and things that I just had no clue. I wish I would have known you then, but then again, God wouldn't have put me on the path that I'm on. So it's great that I'm meeting you now because it's like, wow, I have resources for those who say, oh, I want to open a residential care home. So let's tell the viewers the benefits of being in a residential care home versus being in a facility that has 50 or more people.
So typically, and based on my own experiences as a surveyor, larger facilities, not that they don't offer good care, you'll oftentimes have one staff to 10 or 15 people or even more, depending on what their regulatory ratios require. But when you're in an actual home or residential care home, you get more one-on-one care. So most small facilities that are in residential care homes are not going to hold more than 8. Now, you can have a small facility up to 16 if it's an assisted living facility, but I'm saying the smaller homes in the neighborhoods are not going to have more than 8 people in them. So you get a one-on-one care base. You get to understand the culture of that facility and the staff there. You have a greater connection to management. You have more input on your care, or if you are placing a loved one in a residential care home, you have more input and more ease in communication when it comes to developing that resident's care plan. I've seen people do really well coming from larger facilities to smaller facilities because they needed that one-on-one care, because they wanted someone that they knew by name every day. And sometimes in the bigger facilities, they're filling in as PRN staff, whoever they can get their hands on for the day. That's who's coming in to do the work. So it just provides a more intimate setting. I won't say that it provides a better setting.
Right.
It depends on the person.
Right. It depends on who is running that home, because I know a lot of people that say, "Oh, I want to open up a residential care home and I'm gonna make all this money." Right. It is
No, ma'am.
a, it is, it's a work of the heart. You,
Yes.
woo, yeah, so much.
Yes,
But
ma'am.
what I love about the residential care homes is that, like you said, it is a smaller, more intimate setting. And so a lot of them are licensed. So when they want to be licensed, you help them through that process. So, is that correct?
Yes. Yes, ma'am. Yes, ma'am. There are quite a few smaller residential care homes in the Texas area, period, but specifically the North Texas area. Some are unlicensed, but those who have more than 3 persons in their home should be licensed homes. And yes, ma'am, I help them get their licenses. Specifically, if it's an assisted living facility, I help them start to finish with the application process, um, gathering all necessary documents, putting together their policy and procedures, ensuring that the facility is going to meet the regulation standards. So for assisted living facilities, you have to have a sprinkler system and certain fire safety measures that other programs don't.
Yes, you do. So
Yes,
that
ma'am.
was something that I found out the hard way, because I had a house,
Yes,
okay,
ma'am.
3 bedroom, 1,800 square feet, 2-car garage. Was gonna turn. I turned it into a small assisted living for 6 clients, and you do have to have it fire sprinkler system. You
Ma'am.
know.
And, those,
Yeah,
and so one thing that I do is I link my clients to resources.
that's
I actually
awesome.
have a fire alarm and security company that I work with. And it's not the only one that I refer to, but they offer payment plans
Right. Right. Yeah.
because those things can be 30, 40, $50,000 depending on.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
So
Yes, ma'am.
so as I work with my clients, I link them to resources. I help
Right.
them find what it is that they need to push forward because there's no one else in this regulatory agency or doing the work from the regulatory agency to give them those resources.
Nope. 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 I can tell that from experience, because, you know, you have a big heart and you want to, help people on that level, but some people have no clue. They think they can just, have some people in the house and they just going to be a loving big family. But you have to realize you have to deal with that person and their extended family and their healthcare providers and the state and the city. So it's
Yes,
not
ma'am.
just I don't want to talk anybody out of it, but also it is a labor of love, and you need to have your checks and balances in place.
Yes, ma'am. So I tell people this all the time. You can definitely make money in the long-term care field. That's not even a question. Okay.
Mm-hmm.
If you don't have a heart for service and you do not understand the level of responsibility that comes with caring for people who are potentially disabled, whether that be mental illness, physical disabilities, intellectual or developmental disabilities, or other issues that they face on a daily basis that alter their ability to live on their own.
Right.
That's a whole nother ball game of care. You have to have um, like you said, a heart for service, but you also have to have a mind that are after people's hearts.
Right.
And that's also a different ball game. Your understanding and your ability to see people for who they are and help them has to be there.
And
It
in
just
other words, what we're saying, don't go in it just to make money, quote unquote.
don't
Don't
mean.
go in it saying, oh, I'm going to make all this money and I'm going to have these people. It's supposed to be about the people.
Yes, ma'am.
That has to be your number one reason. Now, making money is great.
Of
Not,
course.
I'm not necking that at all. But at the same token, it's a big, humongous responsibility.
Yes, ma'am. Because you
Hmm.
literally have people's lives in your hand.
Right.
And
24/7.
24/7.
Mm-hmm.
And when you're governed by a regulatory agency, They don't care about your excuses. They don't care about what you could have done differently. If the person is harmed in your care, you are ultimately responsible.
Right,
That
right.
comes with a whole nother set of a whole nother ball game, so to speak, if you get into, you know, not properly treating those clients right, and you open yourself up to liability.
Mm-hmm.
I always talk to my clients about where their hearts and their minds are.
Right, right. Not providing the amenities that they deserve, because it's a lot to ask. Because when somebody's going through something like that, just think about it. You're 70 something years old or older, younger. It doesn't, age is really insignificant, but you're giving up a certain level of independence
Ma'am.
and a certain level of responsibility. So you need to be getting the highest quality of care possible when you're looking at that. I would have chose a residential care home and had my mom still been here, but I would also want to make sure that that residential care home was taking care of her to the best of their ability, especially in comparison to some of the bigger conglomerate facilities. You know, what am I
Yes.
getting for my money? What is she getting more attention? Is she getting more medical attention? I mean, is she being entertained cognitively? You know, um,
Yes, ma'am.
is she being kept active, or is she sitting in a chair all day just rocking the world away? So you have to look at that. So what are some of the things you would tell someone looking at some of these residential care homes to look for?
So the first thing that I would do is simply look at the way that the staff treat the clients that are already there. Look at the communication that the staff has with the manager. Is the manager available? Can you call the manager if you have questions? Do you have access to the resident, whether it be the resident or their legally authorized representative? Do they have access to their files and their documents? Can they request, hey, I want to see the doctor's notes, or I want to see the progress notes? You know, you want to see if they have a level of transparency that makes you comfortable. We're all different, but transparency is required for all of us. All of us want to know what's in place. Is my loved one going to be cared for? How are you going to treat them?
Yes.
And so ask the questions that you want to ask. How often are y'all offering lunch? Is she eating lunch in her room by herself, or is she at the dining table? How often do you do activities? Are you doing activities once a week? What type of activities are you doing? Walmart activities? Is it playing checkers? Is it bingo? What other things are you doing? What about nutrition? Let's say, for instance, you have a loved one that has a no salt added diet. How are they sure that your family member is following that nutrition plan? It's looking at your loved one, looking at the facility, and saying, these are the needs of my loved one, or these are my needs. How are y'all going to address them to make me satisfied?
Right, right. So very, very true. Another thing that I would add is, their open door policy.
Yes, ma'am.
What is the visitation, especially during this season? So I've gotten a couple of phone calls with people trying to navigate hospitals, doctor's office, and different facilities. What would be what's something that you've gotten during our new season?
So I had a client that did have COVID. And so we had to come up with a plan for how they were going to serve that client and not expose everyone else in the facility. Okay. And not limit their rights to see their loved one at the same time. Okay. So we had to work around the parameters of the COVID-19 quarantine guidelines by the CDC to figure out how this client was going to be able to see their loved one, which was very important to them. It was one of their objectives. Also, to have one-on-one staffing so that staff wouldn't be going from that COVID patient to other patients, or residents rather, excuse me. And then how are we going to clean and sanitize the whole home to ensure no one else experiences this? So it wasn't difficult, but there were just a lot of parameters that we had to follow in order to satisfy that. And the family members were still able to come see the client, but what we did was we had it to where they could look at them through the window and talk to them and say, you know, we love you, we're here, we'll come back and visit you once it's safe. And you make a plan to not only solve the problem, but to satisfy the client in the process. And the one thing I tell people all the time, we make things more difficult than what they need to be. There is a simple solution to the COVID-19 when it comes to ensuring that our loved ones are seen about and cared about. You put up the right parameters, whether they be visiting through the glass screen door or coming to the window, or, hey, we're gonna play computer games and you're gonna look at me across the screen. But we have to think outside of the box as providers and say, hey, I'm gonna meet my client's need. It doesn't matter.
Absolutely.
Not the way it traditionally would be.
Well, it was so great that we're living in a day and age with technology, because you got FaceTime, you have Duo, you have, there's really no major excuse, you know, that you can come up with. I mean,
it's always a way.
Yeah. You just
there's always a way.
A learning opportunity, right? It's always a learning opportunity. So
yes, ma'am.
Your clientele basically are people, business owners who are wanting to open up a assisted living residential care home, or have already opened one up and maybe they're having some hurdles that they're having to encounter. What's your thoughts on those that are not licensed? Do you think?
So I've been in unlicensed facilities. When I worked for the state, we would sometimes have to go out to those facilities to ensure that they are not operating outside of their purview. So all unlicensed facilities in the state of Texas can only have up to 3 residents in their home. Okay. And there is no particular governing agency that they have to abide by. Right. I've met some very great owners and managers of unlicensed facilities and clients who were more than happy because they got the type of care that they wanted, and it was still within realm of the purview of unlicensed, because they can only do so much. They can't offer skilled care. You know, they can't offer certain services that a licensed professional would need to offer. Okay. But the clients were really happy. They were satisfied. They had what they needed. Right. And then I've been in some unlicensed facilities where they should have been shut down immediately. And so I have a varied view about it. Not necessarily for them, but I'm also not against them because of those that I've seen really help individuals blossom and give them what they need. Right.
You just have to be very diligent.
Yeah. And the percentage of really great unlicensed is probably low. It is. I won't knock all of them just because of the experiences that I've had with a few of them. Yes,
so that's great to know, because you don't want to label, you know, a facility because they're not licensed. Maybe they just want, I know a great residential care owner, I'm gonna have him here on the show too. He's not licensed, but he knows he has just 3 clients, the 3 private rooms, and it's a great place to be.
Yes,
I've actually visited, but then like you said, you got some of these other ones, it's like, oh my goodness.
So the one thing that the one thing I will say about this, even though it may be an unlicensed, it should still have a professional presence.
Thank you.
Okay?
Thank you.
So that's my caveat. I believe all businesses should have a professional presence, website, emails, all of that stuff.
I'm going to say this too, Ashley. I'm going to go one further. Even if you aren't licensed, you should operate like you're licensed.
Yes, and that was going to be my next step. And even if you aren't licensed, up until you get to the compliance rules that are specifically for ALFs, like sprinkler systems and all that other stuff, you should operate as though you were licensed. You should operate as though you have someone to answer to for the care of those residents. You should have policies and procedures. You should have an operations manual. You should have
evacuation plan,
and a budget and a management system for all of what you're doing, because you are still operating a business, period.
Right.
And also, if you want to protect yourself, especially if you don't have an LLC or a corporation that you're operating under, you also want to have errors and omissions professional liability insurance. Everybody should have that regardless, but particularly if you're operating an unlicensed facility and you don't have any type of business entity outside of a sole proprietorship.
Right. So do you do classes, for people, or have you thought about it, or, somebody?
So I actually am getting ready to put together my first webinar. I'm going to do virtual classes. Yes, ma'am. This particular webinar is attached to my handbook that I created for assisted living facilities.
Okay.
I'm preparing an assisted living facility for licensing in Texas. And it can definitely be found on my website. I'll be offering a webinar to go with that to teach from that book. And then I will be offering the book as well. And then after that, I will start offering webinars on how to do basic things to keep your facility running smoothly.
Well, when is that webinar going to be?
So I plan to have the webinar released by November 15th. I'm putting together a team of people who are going to help me get this thing right. So my release date is November 15th. Yes, ma'am.
Awesome. Well, I would love more information on that, because I can help blast it out also on our perspective, because I am firmly believing that you don't want to do this alone.
No.
You want to have someone such as Ashley in your backing. Unfortunately, I did it all alone. Well, almost alone, but that other half is gone, honey. So anyway, but I'll say this: you want to have that. You don't want to know what you're getting into, first of all, before you get into it, and you want to know that if it's for you, it's for you. If it's not, it's not. And I love the fact that you're going to be doing these webinars, because it'll give the people the good, the bad, and the ugly about, okay, is this something really for me?
Yes, ma'am. And I do offer a free 15 minutes compliance assessment for clients. Sometimes I extend them to 30 minutes, depending on what type of information or understanding, rather, that potential client needs. And I help them understand what options are out there. I help them understand what the requirements will be on set for the type of program that they're getting into, so that there is no confusion, because it can run you upwards to $400,000 just to get a new facility up and running, depending on whether you're buying new construction or you're renting the house or whatever. And so you want to be prepared.
Right.
Because there's a lot of money going into some of these homes.
Oh, yes, ma'am. Especially if you want to have a high quality home.
Yes, ma'am. Because
yeah.
Yes, ma'am. Because now, don't get me wrong, there are facilities that are available for people who are low income all across Dallas. But if you're looking for the industry average, which is about $4,500 a month, right, you're going to want to have a home that looks like $4,500 a month.
And then even, let me say this, even for our clientele who can't afford the $4,500 a month, just because they're paying $1,000 or $800 doesn't mean that you give them mediocre, subpar care. You still got to be held to that standard. So.
Oh, yes, ma'am.
Yeah. So I wanted to say that, because I'm very passionate about that. I just think people should do the right thing all the time.
Right. And that's why I said the home needs to look like, not the care. The care should be the same. I don't care if the home is 50 years old and the cabinets are older and it passes inspection and you're only charging $1,800 a month for your care is still there. That should never change.
Right.
Never change.
Right.
Never change. But for those people who are looking for the higher in dollar speak, the home has to reflect it, because most people are not paid, you know?
Yeah, and then not only the home is, I thought about when I had mine, the amenities, what was your loved one getting when they came to the home that I had? They had optional activities that they can participate in, things that will enhance their mind and their socialization and their cognitive. And so people have to look at that too. I really want you to, when you're looking for a home, whether it be a residential care home or an assisted living, really, like Miss Ashley said, delve into, talk to their staff, talk to the residents that are there, don't be afraid to ask questions.
I'm sorry, I didn't mean to cut you off.
That's okay.
For a services list or a brochure, and then whatever they say that they're doing in that, how? Ask them how. Ask them how often. Is it a third party service? Are you booking these people to come help? And I'll give you an example. I actually just helped an unlicensed facility get started. And the reason I did is because this particular person came from a home health background, and they already had it within them to understand the type of care that the clients needed. We developed his whole back office system. And one of the main things I did was sit down with him and say, hey, what amenities are you going to offer beyond room and board?
Right.
Food. And so we started talking about it. He said, well, I have a social worker who's willing to come in and bill their insurance if they want someone to talk to them. I have a nurse that's willing to come in. I'm going to have a musician come in once a month and do live music for them. He had a plan for how to serve those people and to give them what they need, and to also make them feel as though they are important and special.
I'm so honored and excited to have you here today, because it's just such a passion for me to, be able to provide resources for people who have that heart to serve. So if a business owner, or if you're dreaming about a residential care home, you're thinking about a residential care home, you're already in a residential care home and operating in a residential care home, how can someone get in touch with you?
Yes, ma'am. So you can reach me at my website, which is www.roaconsulting.services. You can reach me on Facebook or Instagram at Real Organized Advocacy. And you can reach us by email at info@roaconsulting.services. Or you can call us at 214-463-3124.
And if you forget any of those, reach out to me. I will get you hooked up with Miss Ashley. So thank you so much for this today. I have truly enjoyed our conversation. Again, Ashley Austin Hill with ROA Consulting. She helps residential care home owners run their residential care home the right way. So, anything else you want to add?
No, you listen, I'm gonna put you on my PR team. Yes, ma'am. No, I've had a great time, and just thank you for even having me on. It feels
We'll
good.
definitely have you back where we can hone in on a more specific topic, because anytime I have my experts on, it's so much that you can talk about, but I like to have you on, introduce you, at least get you, into, everybody's mind, and then we can start honing on maybe a topic that you've had issues with most of your clients helping them with, or something like that, or if you think there's something important that needs to be honed on and talked about. So
yes, ma'am.
Awesome. Well, again, my name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. I love helping you navigate the complicated healthcare system by bringing you reputable resources. Thank you again for tuning in to Health Chats Among Friends. See you next time with another amazing expert.
Thank you.